The virus captures the nation's attention. Some advocates are teaching people about another serious illness. More than 7 million Americans are stroke survivors. It is one reason that May is National Stroke Awareness Month. WSAV News 3's Kelly Antonacci is on your side with how to spot the disorder in tonight's health report.
American Heart Association is known for bringing people together to talk about heart disease and stroke. This time, it's happening virtually.
If it weren't for organizations like the American Heart Association, we would not have advances that, are here today.
Ainsley Howes works with AHA because of her dad. Tara McInnes is here because she has a rare brain disorder called moya moya.
There's a lot of isolation, which is a very strange word to use right now, particularly during COVID-19. But there's a lot about being a stroke survivor that can be isolating.
McInnes says that anxious feeling a lot of us have right now is something she's felt most of her life.
There's no cookie cutter mold in how to work with a stroke patient. A stroke patient can have physical deficits, they can have cognitive and mental deficits, and a stroke is life-changing.
People with underlying health conditions are more at risk during the pandemic. McInnes says her focus is on the word fast. It represents the symptoms of a stroke when speed is important. Face drooping, arm weakness, speech difficulty. Time to call 911.
People are hesitant to dial 911 when they are having symptoms of a stroke or symptoms of heart failure or heart attack.
Horst says donating on Giving Tuesday is the best way to bring people together in this new virtual reality. Donations to AHA go to research and support for survivors like McInnes. Kelly Antonacci, WSAV News 3 on your side.
And the AHA has a $2.5 million grant to study COVID-19's impact on people with heart or brain diseases. If you'd like to help them continue their mission, visit WSAV.com/stroke awareness.